Thank you, Peter, for that kind introduction, and also Sean and the organizing committee. I appreciate the opportunity to speak, and congratulations on a really successful first symposium. Now, my disclosure, first of all, I'm not a data scientist. I'm a physician, but an enthusiast of data science. And this is a collaborative work with Kristin Yom from Stanford. Unfortunately, she's not able to be here to present her part, but she'll be here tomorrow to moderate a session. I think clinical duties take priority. So how many of you in the audience are actually in healthcare field? A lot. That's great. My presentation is giving you a clinical perspective, an operational perspective of where AI can play a role. Now, radiology, just for you, if you are not familiar with, radiology is one of the youngest discipline in medicine, but one of the most exciting and transformative field in medicine, where it has completely transformed many areas. I don't think so there is any discipline in medicine that has not been impacted. I would say in other way that there are disciplines in medicines which are actually being influenced heavily by advances in radiology. These are tremendous technological developments we have seen, and the pace of innovation continues. What does it mean? First of all, we have gained tremendously in temporal and spatial resolution. That leads to better image quality, better details. We can freeze motion like cardiac motion, and we can provide details, structural details of the heart. We can make better diagnosis easier. So you can imagine, for example, abdomen was considered a Pandora's box for surgeon, because when they go to operating room, they will uncover things they had never imagined. With radiology, they have precise information, what they are going to do. So that has been a big impact. Now we have also seen contribution and development on the tracer side, where we could do more physiologic and functional imaging. So this is leading to more reality on the precision medicine advances. Now, all these developments in radiology is leading to tremendous utilization of imaging. I'm giving you an example with the use of CT. CT is being used a lot in outpatient and emergency room setting, and if you look at certain areas, they are impacting growth in CT, like acute care, oncology, a lot of image-guided therapies, neurosciences. All this is leading to increased utilization of imaging. Now I'm giving you an example of CT, but every imaging modality is being heavily utilized because the impact imaging is making on the decision-making in discovery. So for example, last year in the United States, we did over 80 million CT scans and 40 million MRI exams. So that puts tremendous pressure on the health system, on the cost, and the growth continues. So let me give you an example from the University of Washington. We are a health system. We have multiple hospitals. In 3 of the hospitals, we have a robust ED, which is heavily utilized 24/7. Last year alone, we did more than 180,000 imaging exams. Approximately 60% of patients who come through ED, they get imaging studies. So it puts tremendous pressure on radiology because the triage, the decision-making is influenced by what radiology presents to the referring providers. So access is critical. The communication part, the report turnaround time, these are some of the expectations from our patients and providers. What is happening in the healthcare landscape is impacting radiology heavily. First of all, we have witnessed a tremendous shortages of radiologists. In the healthcare field, we know over hundreds of thousands of healthcare providers have left the space. More than 100,000 physicians have left healthcare field for many reasons. Some have retired, some have reduced their efforts, some have moved to other areas that is not directly related to patient care. And there are many reasons for that, and I don't have time to get into the reason, but the expectations from our healthcare providers and workforce is changing. Now, what you see here is the ACR, the American College of Radiology, which is one of our leading societies, the job market. And in the last 2 years, there is unprecedented growth in the demand for radiologists. There are so many job postings, we don't have enough pipeline to support that type of a demand in radiology. Now, with the utilization of imaging, we need more workforce. We need technologists to really operate these sophisticated systems like MRIs, the CT scans, the hybrid imaging like PET CTs, ultrasound. All this requires a skilled workforce. And unfortunately, the pipeline is weak. Not many are pursuing this space of being a technologist for a variety of reasons. So there are predicted shortages for MRI technologists, and you can imagine with the high demand for utilization of these imaging for decision making, this is going to create a bigger challenges for radiologists. Now, this is a snapshot of a data from American College of Radiology website for radiology job postings. Now, this is not all radiologists. This is all job posting that include technologists, includes billers, encoders, as well as radiology assistants. You can see in last 5 years, there has been unprecedented demand in the radiology jobs. So all these we cannot fulfill in a short time, and also in the next 5 years, we cannot be able to meet these expectations. Other challenge, which probably is familiar to you all, is in healthcare field, generally the younger workforce feel more disengagement or less connected to the purpose. There is less curiosity, and this is leading to more burnout. The job is less meaningful, and I think that is a huge problem. We need to fix that. One of the examples we heard in the morning is the EHR itself is challenging. People find it difficult to deal with all the tasks you have to do to accomplish your day's work. Now, other challenge that is also our ethical moral obligation and responsibility. If you look at rural health space, 15% of all Americans live in the rural America. And problem is we don't have enough providers. Less than 9% of physicians practice there. During COVID, we had seen tremendous challenges. Some of the hospitals have shut down because of financial and workforce shortages. And this has exacerbated the challenge in the rural healthcare space. The biggest problem, the big 5 diseases that we have to confront is including heart disease, cancer, trauma, stroke, and chronic lung disease are some of the conditions where need help. Clearly, health system like ours in the Washington state as well as in the bigger WAMI region have obligation to create access in the rural America. We can use technology, we can use the telehealth as we have used during COVID time to really improve their access. And this is a responsibility we will have to confront with. When we look at the emergency rooms, they are exceeding capacity. Before COVID, we were seeing a lot of our population seeking care primarily through ED because of challenges of accessing prime physicians. Post-COVID, there has been tremendous growth. Most of the EDs are functioning beyond 100% capacity. Patients are leaving ED because they are not having access to the healthcare providers. In Massachusetts alone, one of the ED reported more than 6% of patients actually left ED because they couldn't wait long enough. What does this mean? I'm sure this leads to more healthcare disparities. This can lead to harm to patients as those who come to ED clearly have some health challenges and symptoms that requires urgent attention. The landscape is also changing because the traditional healthcare model is no longer stable in United States. We have new entrants. We have technology vendors getting into healthcare space. The insurance companies are getting heavily in the healthcare space. And this will be a big competition and challenge for traditional health providers like ourselves in the University of Washington. Giving you that perspective, how does it impact radiologists? Clearly, our priorities have changed. There is more focus on radiology operation and workflow. And this requires, we are building solutions to be more efficient. Therefore, our technologists don't have to do as much tasks, so we are investing in tools and technology to make them more efficient. More standardization, so patient can get same care anywhere in our health system. Gone are the days where they have to come to the main campus for a type of care. Now technology is enabling that we can create standardization, so same level of care can be provided anywhere. To improve access to high-value imaging studies like MRI, which takes time, so that leads to challenges in adding capacity on MR. Some tools and technology to accelerate our imaging. Same applies to PET-CT, which is expensive, but also time-consuming. So there is some opportunity for technology to help us there. We also have obligation to reduce the cost and especially unnecessary exams, and this was touched earlier in the presentation on using some of the clinical decision support to make more appropriate utilization of imaging and focus on more automation, both for physician side but also for technologists. Now, once you see competition from tech world, which has always focused on customer experience, healthcare providers and the health system will have to focus on provider and patient experience and empower them with more decision making. And again, I will touch on how this is going to impact radiology. For the workforce to stay engaged and also be available to provide services, the new currency is flexibility. So we should have technology that allows us to work on-site and off-site, and radiology is investing heavily on that. And one of our big priority is to have robust IT informatics tools and the clinical informatics tool. Now, just to briefly touch on patient's journey through healthcare, there are various aspects that we have to look at. Right from an exam is ordered, what we want to make sure we have tool not only to make sure that exam is appropriate, but also where we can schedule based on patient's comfort, location, time based on their last experience. If patient prefers a certain site and certain time, by default, that should come up for patient. So that is something we need to do. The exam has to be more customized to patient's age, clinical indication, risk factors, as well as other demographic information that is available. Currently, we don't do that. It's one size fit all. Also, when the images are interpreted, we use a language which is not only provider friendly, but also very catered towards our patient, so it can help with the shared decision making. So one of the big efforts that we have taken in radiology is we have moved from a traditional model of someone has to call a radiology scheduler to schedule exam. We have started moving to online scheduling. Certain types of exams, we have moved to online scheduling, and we have empowered patients to schedule their exams. And we also use technology to send them a text and a detailed instruction. So both the scheduling exam as well as canceling or rescheduling is easier for the patient. Now, when we look at radiology workflow, I'm going to give you a perspective, and we are working in all these areas. So let's start with when exam is ordered. From a provider, at the time they are ordering exam, we want to make sure there are tools, these clinical decision-making tool, which ensures that the exam that is ordered is appropriate. Also to look for some of the population health type of information. If patient is ready for a screening exam, my colleague Christoph Lee, who is at the back, is working a lot in this space of how we can use AI for breast cancer screening, but we also apply it to lung cancer screening. So at the time patient is coming for their one appointment, we can schedule their screening exam also. Once patient is scheduled for the exam, we want to make sure there is more automation in the protocol, scanning, as well as how images are reconstructed. This reduces the work on technologists, so the job can be provided to less untrained technologists. The image acquisition piece can be automated by making sure image quality, radiation dose, and other risks can be optimized for patient. And when images come for interpretation, the image reconstruction, the hanging protocol, how radiologists like to look at images and compare them to prior exams, the quantification information that is available, and the clinical decision support for using the guidelines for recommendations can be embedded at the time of interpretation. So this will make radiologist's job not only more effective and impactful, but also more efficient. So how are we using this technology in practice? So I'll give you a real-world example. First of all, in the acute care setting, we are using AI informatics tool to enable triage for patient. There are different indications I have listed here. Those not in the healthcare field, I will just tell you some of the critical type of cases that if those who might have stroke or hemorrhage in the brain, they need urgent attention. Likewise, if their pulmonary arteries are blocked by a clot, we call it pulmonary embolism, they require intervention, sometimes even invasive procedures or drugs for preventing further clotting. Detecting diagnosis like pneumothorax, which requires intervention, can be made through these tools, including some acute findings in abdomen. So we have introduced this clinical informatics tool. We have working with a startup, so the data from all the 3 hospitals ED setting is centrally processed. We have scanned more than 200,000 patients. And for all these indications, the data is then processed. This is a list that is generated. It prioritizes cases based on the severity or positive findings, so we can really prioritize those cases for reporting as well as for communication. And when a radiologist is reading an exam, there is a contextual information and indication comes up, it pops, it tells them if this is a positive exam, and that helps with the diagnosis as well as communication. So just to share the data, we have done more than 170,000 patients. 10% of those were positive for various indications I am showing you, hemorrhage being the big one, pulmonary embolism is another one. What is most interesting data here is in 26 patients, radiologists had to make an addendum. So when they didn't look at the AI data, the findings were missed and radiologists have to make an addendum. So you can imagine how these tools make us efficient but also augments the impact of radiologists and minimizes our risk. We can triage patient better. These images are processed pretty fast, so really integrates well in our workflow. Let me show you some example. I know these images will not be as obvious, and that's where AI plays a big role. For example, in this patient who had suspected hemorrhage in the brain, blood, this was called negative, but AI detected this small subdural hemorrhage, which was after a second look, that's what tested as a positive. This is a patient who came with the symptoms of stroke. Here, the left middle cerebral artery was blocked, and AI detected that, which was missed initially by a radiologist. And this is a patient with an unsuspected pulmonary embolism, and there is a small clot in the pulmonary arteries on the left, which was missed initially by radiologists. So you can imagine these tools are pretty friendly. These are some of the images from my colleague, Christian Yam. Here, these are 2 examples. On the left is an obvious cervical spine fracture. On the left side is a subtle cervical spine fracture, and these patients require urgent intervention to stabilize the spine. Otherwise, it can have a devastating impact and quadriplegia in these patients. So as you can see, AI could detect those fractures, and again, very important to triage these patients appropriately. This is an example from Kristen's study where we do segmentation of ventricles. This helps in patients who have obstructed ventricles to see how they are progressing. And same concept could be applied towards segmentation of other organs like liver, spleen, looking at tumor segmentation, which is very important in decision-making as a biomarker. Sharing you an example of how organ segmentation could be applied to a brain tumor, which is lethan, often seen in young adults or children. These are medulloblastomas, and here machine learning algorithms could be trained to extract those features, detect as well as classify and quantify that. Other area for radiology where I feel machine learning algorithms are going to play a big role, already we are seeing tremendous promise based on the research that has been published, is opportunistic screening. So let me give you what opportunistic screening means. When we do imaging, we use less than 10% data. I would say that is optimistic figure. We use less than 5% of data in decision making. Rest of the data is wasted because the human eye can't visualize these and cannot quantify. But with AI, we can extract that information like fat in the liver, atherosclerosis, muscle mass, looking at bone mineral density. All these findings which have impact on patients' outcome can be now extracted. And you can imagine this will be used for better disease prediction, early intervention, and for improving patients' health. So that is a huge opportunity that we can increase value of existing imaging studies. Other is where radiology will have a big opportunity is to look at how we can use machine learning algorithm for integrated diagnostics. What do I mean by integrated diagnostics? Traditionally, when we look at imaging, we look at certain features, how a lesion is, how its margins are, how it enhances. And these are part of the guidelines where we classify lesion as either benign or malignant based on a scale. But what that classification doesn't factor is patient risk factors, demographics, and other EHR information. So you can imagine this patient with a chronic liver disease who is at risk for developing tumors called hepatocellular carcinomas. These patients are screened with imaging. Now we could actually integrate imaging information with all the other factors that can increase patients' risk for malignancy and poor outcome and come up with a better probability score than the conventional classification system. Similar concept, of integrated diagnostics by extracting the radiomic information from a medulloblastoma that I shared with you is showing the value of how we can augment human behavior by extracting information which is not visible to human eye and provide a much better prediction of a disease and outcome. This is an example of how one can use AI to better diagnose a embolus in a cerebral angiogram, automating that process. Again, another example where one can use AI to augment human behavior to detect cerebral aneurysm on CT angiogram. Some of the small cerebral aneurysm can be missed, and here you can see this data shows that AI-enabled diagnosis is far more accurate and reduces variability. I think in the interest of time, I'm going to quickly go to my last slide, and I'll say that with all the challenges healthcare is facing, radiology has been affected the most. And to confront with stakeholder expectation and these challenges, we need to have a strategy with AI and an investment in a strong AI program that we are doing in the department so that we can improve our workflow, we can have a better, more effective triage system, we have a better diagnostic tools, we can communicate more effectively and efficiently, and also we can have an impact on the research in this space by looking at health outcomes and cost. With that, I want to thank you all for the opportunity and also want to say that a strong investment in AI is for the benefit of patient care and for radiology as well. Thank you.